Hello, I'm Rebecca O'Donnell. I'm the Director of Epidemiology at Albany Medical Center.
And I'm Carrie Danziger. I'm the Division Chief of the Pediatric Emergency Department. I'm also leading the Personal Protective Equipment subgroup of Incident Command.
We held an open forum on Monday, April 13th, and we received all of your questions, and we wanted to come together today to talk about those top questions from the open forum.
So one of the questions that came up pretty frequently was regarding the precautions for PUI or COVID positive patients. Rebecca, have any of those precautions changed?
So those precautions have not changed. We're still using enhanced droplet and contact precautions when we do routine patient care. And for aerosolized generating procedures, we're using an N95 mask. So one of the big questions we got from open forum was, is a nasopharyngeal swab an aerosolized generating procedure?
That's a really good question. So on our website, you can find on the COVID page where we define these aerosol generating procedures. An NP swab is one of those challenges that the CDC has some conflicting information. We're following the information from the New York State Department of Health that does not believe a nasopharyngeal swab is considered aerosolized, although sometimes coughing or sneezing will be induced. Those are large respiratory droplets, and you're protected with your standard mask and your full face shield in addition with your other precautions. Now, we've been doing a lot of talk about extended use and reuse of masks. Can you describe that for us?
Sure. So extended use of a mask is keeping your regular standard mask on with your eye protection for as long as you can have that mask on. This is now in accordance with the executive order as well, to have that standard mask when you're having patient-facing contact. Reuse of masks is where we're taking our N95 masks, and once they need to come off of our face, we're putting those into a bag and we're sending those for Bioquell, which is a decontamination system that we're using here. So we've gotten a lot of questions about Bioquell and if this is safe. So can you talk about Bioquell and how we're doing this?
So Bioquell is a hydrogen peroxide vapor. We've been using it at Albany Med for over 10 years to decontaminate patient care rooms and equipment used in the operating room. The byproducts of it are safe. It byproducts into water and oxygen. So when you send your mask for decontamination, it's tested, it's safe, it will come back probably in a little bit over 24 hours. We've developed our processes out of many other major institutions that are using it across the country. It was approved by the FDA as a use for N95 decontamination in 2016.
And so, Carrie, we talk about 20 times, but that's not to say that we wouldn't scale back if we realized that those masks were starting to break down or the provider felt unsafe in that mask. You always want to make sure to fit that to your face, and there's instructions online on how to do that fit test when you get your mask back.
Absolutely. At any point, if it's soiled or moist or distorted, you should absolutely throw it away. A lot of people have asked, how do I protect myself in the hospital and at home?
So again, this is basic infection control and prevention. The number one way to protect yourself from any respiratory viruses is hand hygiene. Not touching your eyes, nose, and mouth with contaminated hands, covering your cough, using respiratory etiquette, staying home while you're sick, and not going into public while you're ill. Another big question, can I bring my own personal protective equipment into Albany Medical Center to use? My own N95, my own cloth mask. What's our stance on that here?
So our stance on that is that cloth masks have not been tested as use as official PPE, and we don't support the use of those when we're having patient contact, especially with a PUI or COVID positive patient. We just don't know on the safety of that. As for N95s, the main concern is that if you are wearing an N95 that you're not properly fit tested for, or if it's not OSHA compliant, we can't guarantee that that N95 is going to keep you safe. So we really discourage the use of home N95s.
And then, Carrie, just to end, I know you and I talk, and my team and your team talks every single day, and the most important thing I think to tell everybody today is that doffing your personal protective equipment and keeping your hands clean while you're doing this and you're touching your face to take this personal protective equipment off is the number one way in the hospital setting when you're taking care of these patients to protect yourself from self-contamination. Would you agree?
100%. And especially now, in lieu of everyone wearing masking around the hospital, we very much encourage you that if you feel that you touch your mask or readjust, please perform hand hygiene afterwards, and always hand hygiene before you touch your face or put anything in your mouth.
Thank you all for joining us. We would just like to also say thank you for everything that you're doing to care for our community.
If you have any further questions, we do have a email account, ppe@amc.edu, for any further questions. We also do re-education throughout the hospital with a lot of the educators. The PowerPoint will be available on the intranet shortly.